Good morning, sir.
Good afternoon.
Good afternoon, sir. How are you doing today?
I'm fine. I just entered this hotel to join the IANCON, and I will be here up to the end up to 6th. And obviously, we have to here attend these our seminars, interact, and also participate.
Right.
That will be it's a more on the educative sides, the seminar, everything, sharing of the knowledge and learning a lot.
Right. All right. And just before we proceed further, may I know your name, sir?
My name is Dr. Goutam Ganguly. As a professor and head of the department, Bangalore Institute of Neuroscience, Kolkata.
And also, I would want to know, all the way from Kolkata, you have come here just to attend this conference that is for awareing people on the most amazing and something that is very widely seen in the patients, which is epilepsy. So, I would want to know. I'm sure you have a lot of people that you know who comes to you for epilepsy itself. So, what is the most common symptom they tell you that this is something that we go through and you hear every now and then?
The epilepsy, obviously, one of the commonest neurological diseases all over the world. Though 80% it's restricted in the developing country and 20% in the developed country. And this epilepsy symptoms more common is a loss of consciousness with generalized tonic-clonic movement or partial movement, and the loss of consciousness persists for the more than 1 minute. And not if it is the less than 1 minute, that there will be a differential diagnosis of syncope and epilepsy. So epilepsy diagnosis is depend upon the witness history. That is the description, not by the investigation. Only investigation on supportive role only exclude any secondary causes or electro EEG that can be changes certain type of epilepsy that can be, and whether true epileptic focus is there or not. But normal EEG does not exclude epilepsy. Normal MRI or CT scan does not exclude epilepsy. Another thing is there are so many medicines now available. Near about 30 newer medicines are available in the epilepsy. So 60 to 65% cases we can control with proper medications. And that medication, if it not works, I think properly, initially we have to be re-evaluate the patient whether I am wrong to diagnose this case of epilepsy. If it is epilepsy, so whether the symptomatic classification is wrong, that is the absence seizure. I think it's a complex partial seizure. The different medicines will be there. So that will be problem in there. Number two, whenever we shall give any medicine in our developing country, we have to think of affordability, availability, and the adverse effect. Number three, what I have just observed during my 25 years experience, there is a myth, superstitions with epilepsy, especially among the female women with epilepsy. What I think during that time, it is very easy to say a father or a brother that my daughter or my sister have diabetes and hypertension and on antihypertensive and oral hypoglycemic or insulin. But if anyone say that my daughter has a loss of consciousness, if that will be said during that time, in that case, the opposite side, they will, on the illiterate people, they will say that he's she's a convulsion, seizure, or loss of consciousness. We do not allow him to my house, welcome her to my house. We do not allow to marry with my son. In case of educated children, they can do the shodhanas in a different way, that there is a recurrent loss of consciousness. 1 or 2 times she may go to the kitchen, there may be an accident, how it is possible. So every year I perform 5 to 6 epilepsy camp. And I also giving the assure and arrange 110 ladies that married. Only one there was a divorce, but again and from a remote village. And I pursued her parents and herself that today the while we the male are married 1 or 2 times, 3 times, why you should not? There is a you are now say already your husband divorced you and you do not go to the court case because you are the poor, you cannot spend money. I told her that I shall give the logistic support, legal support, but she refused because if there will be any broken of relation, it cannot be sir. You cannot bind this again. This is the marriage set. This is not a wooden piece or the glass that you can bind this again. Even that bind, there will be a scratch mark will be there. Right. So after assuring her and her parents, I arranged second marriage, and now she's a happy mother of 2 sons. It's a courage. So I always prefer give the parents that the epilepsy in most of the cases, except those who have the mentally retarded, who have the brain structural defect, behavior disturbances, or any paresis or physical abnormality. Besides this is a very few percentage. Most of the cases, epilepsy is treatable. It requires prolonged treatment. Even if this is not controlled with disease, we can control it with the medicine, surgery, epilepsy surgery, and they're sophisticated. And this epilepsy person, this is not a disease. Epilepsy person, either it's epilepsy with male or women with epilepsy, they can perform their normal activity. They can perform their normal daily activity, daily duty. They can do their own education. A girl can go to the school, go to the college, can do the services. Even is that they can marry and can spend a happy marital life, and she will be a very good mother. So in most of the cases there will be no bar. There should not be any superstition. There should not be myth. This awareness I try to spread among the people and in the villages, remote places, in my localities and other places. And I see it's successful in 1920, in 2000, early 2000, and now there is a change of ratio. Initially, the parents come, my daughter has a seizure, whether Dr. Saab, I shall talk with I shall negotiate her marriage or not. There was now, at this moment, the male are coming that I have a seizure, whether it's a genetic one. It's a genetic one, I shall marry or not. My message is, you can spend most of the cases, epilepsy with medicine, you can spend normal life, your knowledge, playing normally, except some few boxing, then ice skating. You can do playing normally, you can do service, except cannot walk in front of a sharp weapon. And I explain the epilepsy patients that you should convey the message. This is normal, absolutely normal thing. You spend only you should not drive, do not allow to swim. If there will be any trainer will be there, obviously you can, and you are well controlled with medicine. That you can do the epilepsies, you can do the allowed to swim, and avoid to do the driving. It's a better, and late night stress, anxiety. Though there is a stress and anxiety is much more prevalent in the society, and I also give the examples of this genius, like the Alexander, Napoleon Bonaparte, Julius Caesar, Alfred Nobel, Agatha Christie, Van Gogh, then John T. Rose, Tony Gray. In our Bengali literature, there is a Manik Bandyopadhyay. and there is a few doctors, and I am also epilepsy and all three drugs. So epilepsy person, the epilepsy cannot prevent the geniusness. Epilepsy is not a curse. Epilepsy is a symptom, and that can be well controlled by more than 85% patient with therapy. And this awareness passion should be spent each and in the local languages to everywhere. And the epilepsy is not but to prevent the geniusity of a person. This number, they Sally, Kids, Byron, this only the name suggests that during that time there was no medicine, but each and hundreds of years, each and everybody, we have to know the Isaac Newton, we have to know the names, and we will, our next generations and generation have to remember their name.
All right. Thank you so much for your information, sir. I think that was very informative. Thank you so much, sir.
Thank you very much.